Thank you. My name is Taiwo Adedeji. So I'll be presenting a work we went to do in Nigeria, which is implementing electronic health records in primary care using the theory of change. So health needs abound, but specifically for this project, we are focusing on the maternal and child health care. So there are problems with handling paper health records. And then to come to the rescue would be to introduce the electronic health records, which meets the infrastructural needs. And then based on the complexities in the health domain, theory of change is a method, which is a process and a product that helps articulate those complexities and sustainability issues as well. So as an objective of this study, we are looking at assessing the feasibility of electronic health record implementation for specifically the delivery of maternal and child health care in First at Primary Age Healthcare Center in Lagos, Nigeria. So as a quick definition, electronic health record, it's the repository of information regarding the health status of subject of care in computer processable form, which is providing those portable information instead of using a paper health records. So for maternal and child health care, that relates to women and their children receiving services in terms of all antenatal care, delivery, immunization, family planning. And so the theory of change being the main method we're using, the process was defined by DFID, Department for International Development. So it's an outcomes-based approach which applies critical thinking to design, implementation, and evaluation of initiatives, and to support change in their context. So in this study, the EHR is the initiative bringing in. So as a setting, it's methods we're using. The location is First Town, and then we've got about 20 healthcare professionals, which include the midwives, the nurses, doctors, and health record officers within this health facility. So TOC maps have been used, and also action research was done in terms of the technical aspect. So we have the OpenMRS, which is the software we used, and we use this because it's an open source software. The code is easy to adapt in that sense. So just a quick explanation. So the long-term change is there, which is the desired goal the stakeholders want for the project. The problems, it's so currently it's the paper-based health records, and then the stakeholders are people who are directly or indirectly involved or affected by the success or failure of the EHR implementation. So assumptions are just the theories we could get from healthcare professionals, from research, and even from the context itself. So inputs are just the tasks that have been carried out for the intervention. The intervention here is the EHR implementation. So the outputs are the results and tangibles coming out from the inputs. And also the measurable effects are just indicators that we could easily measure for a start in a short time. And also for the wider benefit are also indicators, but we can transfer them to other EHR implementation. So this is the initial theory of change, which initially the goal was the long-term goal was to improve services in service delivery in primary care, and then map our way back into the preconditions, which include the problems of prescribing, scheduling, and so inputs were engaging the stakeholders through meetings, and then the intervention is the EHR, like I've mentioned earlier, funding application, and getting requirements as the outputs. The initial measurable effects were completeness of records and empowered doctors, and then the reduced cost and easier clinical audits were the wider benefits. So we went on ground, like you could see from the images, where different aspects in terms of the paper records and the people that were interviewed, where the systems have been used in different services, the pharmacy, the maternal and child ward, and the training as well going on. So after the action research, we're able to revise the theory of change to, accommodate some changes that were made. So for instance, the long-term goal was generic, but now it's now specific to improving maternal and child health care service delivery in primary care. And then working our way back, we found that the problem in after stakeholder meetings, that their priorities were, antenatal care and immunization, how that helps in, audit tracking, for mothers that, have missed maybe immunization, or those that are defaulting in it. And then few changes. So one change I need to highlight here is that this work was presented in a conference in France, and we consulted health informatics experts all over the globe that were in attendance, and we found that data modeling for the EHR interoperability is a key priority, and they were able to present all the outcomes indicators as well for maternal and child health care. So changes to the theory of change, like as I mentioned earlier, so there was the priorities shifted from scheduling problems to antenatal and immunization tracking. And also initially we were set out to do a cloud implementation, but due to internet connectivity, we changed that design to a local area network design setup, which was proved helpful. Expert consultation and assumptions refinement. So the technical bit of it, the EHR was implemented and installed, if you like, so using Java runtime environment, JSON, in terms of designing the form, JavaScript, and then the local area network was implemented. So we secured a favorable ethical opinion, from the faculty ethics. So these are the forms that were designed in the EHR. Good. So just immediate impact, we're able to get, days and months after the implementation. It's, the cost burden was lifted, in terms of the money the local context will have spent on infrastructure. We were able to fund that. And then about 15 clinical staff were trained. So the easier clinical, there was ease of tracking mothers, in terms of if they were defaulting in the antenatal care immunization. And yeah, there was about registration of almost 1,500 patients. So as a conclusion, so TOC is very great in terms of articulating the problems or the preconditions to be able to achieve the long-term goal. And the goal is to improve maternal and child health care in first step PHC. Also, it's very useful for TOC is useful for health informatics projects. So we were able to develop 2 versions of TOC map, which are quite transferable for any health facility or any stakeholder that want to implement EHR in the future. So it's also good for efficient care pathway. So as a future work, EHR sustainability, it's quite very important to work on. So we'd like to thank the GCRF, for the funding of this study. Thank you very much, and so you've got the references as well. Thank you.